like 6 or 7 years old. He said, but they were in great shape. He said, no scratches, nothing.
That is nice.
A little bit of,
I mean, that wouldn't be good for, anyway, right?
see, I like that 4-4 for the back. I said, anyway,
When they,
Yeah, I looked up there and I'm
when they
thinking,
cut me
but if you're gonna do that,
I'm thinking, at least
And I was
you
like-
just went through your intestines, but it looked like, you know,
Okay, are y'all ready? We need to, you guys who are going to Mercy facilities, I have the lady's name in HR if you'd like to write that down. So please do that if you're going to a Mercy facility. Does everyone know what Mercy facilities are? I think I put it on your experience sheet that Mercy should be in the work. Josh, you are going to one.
Yes.
Amy.
Yes.
Chris. Blake.
yep.
Call them Blake, see if they want to do all that stuff again.
Okay.
Weston. Okay, so those are the ones. Her name is Marilyn Frazier. Does that sound correct? I had that written down. And this would be Mercy HR. Sometimes it's hard. She's not gonna call you right back. You have to be a little persuasive. 31479 314 6266. Now, did you Mercy guys have to have a drug test?
Nope.
Okay.
You go to chapter 4, is the test gonna have chapter 4 on it?
No.
Okay.
What's her name?
Marilyn Frazier.
Marilyn Frazier. Do we need the phone number again?
Nope.
Everybody's got it? Okay. This is for legacy. Anyone who wants to bring to it, tell them it's really a drug test. We do that here. What I'd like to do is, well, this is all. That's all. It's a student packet, maybe you have to speak her, if you want me to fax it, I can. Okay, let's see if there's anything else I need to do. Please get a hold of your clinicals quickly. You guys who are going to outpatient, it's not quite, but go ahead and get a hold of them. It's becoming more and more of an issue. I just need you to kind of make sure that they know you're coming. They should. This information, remember, was sent out with letters, though, and when we set up your first clinical, so make sure that you go ahead and do that. Within the next week, please, you guys who are going to Mercy facilities, you need to get that done ASAP. Because that's, so. Also, Stephanie, you better get a hold of Suzanne. Get that, your drug test should be fine. I've got a packet for you too, so come and ask me for it, okay? I meant to bring that, but I didn't bring it.
Jessica, is there anything you had to go before you went over?
I would do it in
Anything you had to do, like drug test?
No, just email Andy, cause he'll send you a whole list of everything he expects.
I'll get it over from you.
You're gonna be in Missouri for the summer clinical. Yeah, I definitely.
Too bad.
Yeah, it won't matter to us. Go ahead and call, get that next started. I don't have any idea even how Missouri has it, or what's required there. Okay. I don't know, I had dealt with them at all.
I was worried about
Yeah,
that.
well, you don't have to come back here and do it as long as it's Missouri. You might want to go to Missouri and take it anyway. They're all over the place, you know, in towns. It just has to be an approved one, and they're like Silva Learning Center, I think is the one that's in, but they literally set up for tests all the, you know, every kind of license. Remember that in-services don't start this Friday, but the next we moved all of them back. Has everybody kind of got an idea on their in-service and you're working on it? Okay, good deal. I guess that's all I need to do before we start class.
So the in-service, we need a basic,
You're going to present information and yeah.
we don't need PowerPoints, nothing like that,
The thing about PowerPoints is that you normally can't take those to the clinic with you unless they have have a setup for that. Some clinics do, but I'd say that's few and far between. So you kinda want to be able to present something off a piece of paper the old-timey way like I do. So you almost have to, unless you're gonna take a computer for you, but not very many. So I would say that's why I wanna do these like this. So I would say don't do a PowerPoint.
Bree had wanted me to do a PowerPoint, which I did on the computer, they asked me to print it out for everybody individually.
Oh, okay. And that's okay too if you, want to do that. That's all right, but, that's not a bad deal. It's just that, if you don't have a PowerPoint, printing it out like that, I mean, it's okay if you have the PowerPoint, you have it printed in front of you because you've seen it, but to me, why not just write out your notes? We've gotten so crazy where we have to do that, it was easier sometimes to do it the other way, so, I don't know. We have to use the computer because that's what we have to do now. Okay, we're gonna talk about Medicare and payment sources and also some of chapter 4. Mainly what I want you to do on chapter 4 is just your homework, so you'll get most of that. We will cover a little bit of it, but, this is very important for you to know, on the Medicare part. And, so you just kind of, any questions, we just need to kind of get this settled for you. Okay. With Medicare Part A and B, do you understand that Medicare people have both a Part A and Part B? What they're paying for, and you need to know this, and this isn't in the PowerPoint, what the people are paying for when they pay their, I think it's like, Social Security check, that is for Medicare Part B. If they have Medicare, they're gonna have Medicare Part A. But Medicare Part B is what they pay that $100 for. Or whatever, I think of it as being $100, but it's 89, or I can't remember exactly what it is. But it comes out every month out of their Social Security. So if you have a family member, normally you're not even aware of that because they take it out before it ever gets to them. So it's coming out. But I have run into patients who have turned down their Medicare Part B services and they get their $100 in their check. So you need to ask people, that's why you have to have all that info, not you, but I just want you to kind of think, you really need to kind of be aware, especially in a skilled facility and just some different places, outpatient facilities. You need to be aware of how many visits you have. Insurance companies tell you, okay, you got 5 visits. I picked up a lady who, for home health, she was a total hip here about a week ago. She had 6 visits. Well, what if I didn't know that? Do I treat her different when she has 6 visits? Yeah, I do. I spend more time on her getting independent. They have to be able to perform their home exercise program almost the first day you get there, right? So you do treat them different. I mean, I guess we should treat all of them that way and push them forward, but you do need to be aware of that. But you also need to be aware of Medicare Part A and Part B, because if it's a Part B service, if they don't have a co-insurance, then the family ends up paying for it, or the patient. So we'll go ahead and talk about that.
So did you say you automatically get Part A if they draw it from their security check?
Yes. Now, there are certain federal employees that have opted out of Medicare, and your railroad people normally opt out of Medicare because they have a really good, they're probably the only people anymore that have this wonderful insurance, it's railroad people. And we have some people like that around here who are on railroad retirement. So they decided not to take Medicare. Also, some federal employees are like that. So you still, I don't run into it a lot, but just be aware that that's a possibility. That sometimes, oh, thank you very much. And then we talked about, there's a lot of Medicare HMOs, and those affect what services they get. So they're really pushing, that's part of Obamacare, is to put everybody on a Medicare HMO. An HMO is, give me an example, Blue Cross Blue Shield HMO. And they'll tell you, the biggest one around here, I can't think of the name of it. Anybody think of it, that maybe your family has decided to, anybody think of it?
Like United Healthcare?
Humana's one. And some of those are Medicare HMOs. So they basically sign over their Medicare rights to Medicare to do the HMO thing. The main thing that HMOs do that are good for people is that it pays their medical costs a lot. Now, Medicare Part D has come in, Medicare Part D, and I should add this to it, Medicare Part D is for medication. Are y'all aware that that's fairly new in the last 4 years? And so they actually, Medicare Part D, you can pay for medication, but a lot of people don't have those plans, so they're still paying $800 out of their pocket. Why they don't have those plans, I can't imagine, but I've run into them that don't. So that's the advantage of doing the Humana and stuff, is they pay a lot of their medication costs. For years, see, we had these wonderful Medicare, but some of these people were paying $800 out of their pocket a month for their medicine. So Medicare Part D has helped that a lot. It's very confusing though. Medicare Part D is extremely confusing.
So is that something you pay extra for and add
Yes,
as well?
yeah. My husband actually is on very little medication, and we pay, what do we pay? $121 a month for Medicare Part D. Which is a lot, by the way. You can get it cheaper than, it kind of just depends on what you're on.
Will they offer it to you, or do you have to ask?
You have to sign up for it. Your pharmacies will push you to do it if you're in there, but especially within the last couple of years. But I have a patient right now that missed the mark, and you have to sign up every year, and I think that's in November. So if you want to change your Medicare Part D, or a lot of times y'all don't pay any attention to it, but there's advertisements on TV that says, make sure you're coming up to the date where you have to check your Medicare Part D, or if you want to change, go back to Medicare and get off the HMO and that kind of stuff. You have to do that during that Medicare part in November. The negative thing about HMO is the facility you go to, if you have to have rehab, let's say, a lot of times they won't pay for a rehab facility, they'll just put you in skilled nursing, even if you really need rehab. Those are the negatives of an HMO for your people. The other thing is, if they really get really sick, a lot of times your HMOs will deny certain medications, especially cancer type stuff. With this Obama stuff, I don't know how it's gonna affect, what's coming down the line is after you reach a certain age, they will no longer allow you to have cancer treatment. It's coming. That's coming.
No doubt about it.
Quality
That's
of
good.
life, or what, is
Yeah.
that what it's called?
Yeah,
No, it's just, if it's
I mean, they
gonna
call
cost
it
them a
death
lot of
panel,
money.
Right.
but it's, I forget what it's called.
it's coming. It hasn't, and
They're
again,
gonna put a price on people's lives is what counts.
yeah, it hasn't affected, the Obama thing hadn't really affected me too much in home health. I haven't seen it. Where I have seen it is in hospitals. They're definitely not getting paid as much for surgeries and different things like that, because I just had that surgery in December. Of course, mine was a medication. Was health choice, but the cost was much less than it would have been 5 years ago. So they're just paying, instead of paying $7,000 for a surgery room, they're paying about $800. I mean, I was amazed at what that cost was, which is much more, it's just that's a lot of money that they're not paying hospitals anymore. So anyway, just as a thing to think about. HMOs are good if people are healthy. That's true, even young people, if they go on HMOs, if you're healthy, that's good. But if something really happens to you that's bad, you don't have the options to always go and do what you want to do. They may not allow you to go to MD Anderson if you get cancer. They may make you stay local in Fort Smith, which actually is getting really pretty good with their cancer care, by the way. They really have brought in a lot of good people and have some really big names in Sparks and at Mercy. So
They're just getting them all trained up to ship them off to Northwest Arkansas.
that's probably true. But anyway, they have some new people there, and it seems to be doing real well. Okay, Medicare Part A. Medicare Part A I always think of as inpatient services. And so it's considered 100% pay. It's of course not really 100%, but they're gonna pay 100% of the inpatient hospital stays. They pay 100% on home health services. And then in skilled nursing, they pay 100% for the first 20 days. And then they pay 80% for the next 80 days. So the other 20% has to be paid by the co-insurance, which normally they do pay. A co-insurance will pay this. But a lot of your people don't have co-insurance. You're gonna find a lot of them don't do it because it's too expensive.
What would hospice be under?
Hospice?
Yeah.
It's a separate entity, it's not Medicare Part A. I don't know exactly what it is. Well, actually, home health hospice, I guess it is Medicare Part A, come to think of it, it is 100%. They really have, as a matter of fact, they've increased, that was the only, area that increased their money from the federal government was hospice. Yeah. So, and then any inpatient like rehab centers. So Medicare Part A, you can kind of think inpatient. The thing you have to think of, again, for your patients, is so much of surgery is now being done as an outpatient, right? So if you have a Medicare patient who doesn't have a co-insurance and they're going in for outpatient services, they're gonna have to pay all that other 20% as approved. You understand that? That that your hospital's gonna, let's say your hospital's 60, maybe 40, and then they're gonna pay 80% of that, and then your patient is gonna have to pay 20% of what Medicare approved.
$60 something floating around.
It's
something
that, you
gotta
see that,
pay.
when you get a bill anymore and it says hospital write-off, that's what it is, they write it off.
Do they really?
Yeah, they don't get that money.
Mhm.
Well, I don't think.
And that's true for insurances too.
Well, I think they overcharge immensely anyway.
They do that so they get Medicare to pay the $40.
Cause I remember when I was having one of my babies, or I wasn't having, but my wife was, and, I don't know, we needed something to wipe the baby's face, or something like that, so we asked for some gauze, so they bring us a little box of gauze, you know? We got home and got the bill, and it was like $40 for this little tiny, yeah, I know, it's insane.
Yeah, I mean, it's coming down, that's what they're paying.
And this was 20-some years ago.
Mhm. They've been doing it a long time. Medicare's been around that long. And so Medicare's actually caused us a lot of problems for all the other
Well,
medicals.
something need to be strung up around here.
Part B is all outpatient services, including physical therapy. So if they don't have a co-insurance, Medicare's only paying 80% of their their doctor visits. 80% of physical therapy. So you have to know if your people have a co-insurance, right?
Need money.
Or it'd be not, yeah. Nursing home patients who are not in skilled are considered Medicare Part Bs. So this is where a family can get stuck owing a lot of money if you don't check in and make sure they have a co-insurance. So someone is doing this now because it happened there for a while, but it doesn't seem to be so much. But you're checking to see if that person has a co-insurance, because you don't want this family to get a $800 bill that they weren't expecting. They're already, nursing home care, when it's paid out of a pocket, is about anywhere from $4,000 to $5,000 a month now. So that's what people are paying, maybe more.
Our nursing home is $165 a day for a semi-private room
Uh-huh.
and $175 a day for a private room.
And how's that come out a month?
Three or 4,000.
Yeah, so it's probably 4, but, yeah. Without another co-insurance, the family would end up paying
$49.50 for the 165.
$49.50. So you're looking at $5,000 a month for a family that's paying out of their pocket for it. So
Do they run into,
Some people have a lot of money though.
they do, but
Not
when
after
you
they
do
get done with that.
5,000, it's going quick.
Yeah,
5,000 a month?
yeah.
Holy cow, it's 60 grand a year.
Yeah.
See, and
It's going quick.
that's why with Obamacare, they would rather just let the patient die than have to pay for any of that. I'm saying not in this scenario, but in a hospital or something, they would just rather than just, which is, man, just makes me, I just want to knock the heck out of somebody, it makes me so mad.
That
It
is
ain't
true.
fair.
but when they have Part B, do they, or another co-insurance, do they run into problems with like pre-existing conditions and stuff like that, or?
Medicare Part B?
Yeah.
No.
No, okay.
No, they don't right now. Medicare's pretty well, you just get it. And so you're not looking at pre-existing conditions. It is, Medicare now for disabled people who are under 65 is different than regular Medicare. It used to not be. That happened about 10 years ago. And so it's not quite the same. So if you're dealing with a disabled person, you need to look into that. It's different than if, there's a lot of young people around here on Medicare, on disability. And the thing too I was gonna tell you is if one, pick them up if they're on disability. It's always a
If you're
2-year
lucky.
waiting period. If you qualify.
And you gotta get a lawyer to do that,
Yeah.
and, cause we went through that with Jacqueline's brother, and he has a terminal illness.
Yeah,
And it took
I'm
them-
shocked that was such a problem.
But Jacqueline, they wouldn't put her on Medicare because she's never really had a job. She did for a little bit, but not enough, so they put her on Medicaid.
Yeah, you have to work, a certain number of quarters, to actually qualify for Medicare or Social Security, period. And I think that's like 2 years. You have to work that much to qualify for that.
Well, she got Social Security, but
She did get Social Security
Yeah.
disability, but not the Medicare.
not, they
Yeah.
took her on
Yeah.
Medicare.
Yeah.
Which I kinda like better because they seem to, cause they said they would pay for somebody to come to the house like every day to check on her.
That is the Medicaid Advantage Program in
Yeah.
Oklahoma. Yeah, that's
And-
good. She
Which
should
is
get that.
something I'm gonna have to start
You need to,
considering.
you need to, well, for one thing, you need to get her qualified for it. So you need to go ahead and ask them to start the paperwork on
How
that. That's
would
different than Medicaid.
Would I just contact Sooner Care?
Yes,
Or-
and say that you wanna apply for the Advantage Program for someone to come in and start helping you. Yeah, go ahead, because it may take a while to get approved. Do you have a social worker or someone that's working?
Not really,
Yeah, just call them and say you wanna apply to the Advantage Program and see if y'all qualify.
okay. Where's my pen?
Okay, I wanna talk about skilled nursing, and some of y'all dealt with this, and when this thing first came out, you know, I decided it's just part of that crazy government stuff that comes out, and you think these people have not been in patient care in 100 years, you know, it's just crazy. But, it was really crazy at the beginning, but now we understand. But literally, when you're in nursing, y'all realize that you monitored every minute that you worked with a patient. And at Restore Therapy, which is where you'll be, I think, I'm not sure they had it yet, but they actually have, like a device that goes with you, and you click on when you start working with that patient, and you click when you come off of it. And so, how much fraud do you think you feel like you might be doing in those situations? You have to have exactly 51 minutes to work with that patient. They're really only needing about 30 minutes of it. But you're looking at minutes, it's a pain. You're always right on the edge of feeling like you've committed fraud. I'm just telling you how you feel. I'm just telling you because that's the way it is. So it's a sad thing that they have tied us down to one stupid minute. So they have to have 51 minutes a day. Did some of y'all deal with this who went to Skilled? Who went to Skilled last time? Nobody? Well, you're gonna deal with it now. You did. Yeah, did you feel that? See, they've kind of moved into it. Did you do any of the charging at all?
No,
Did they have you keep up with any of the minutes?
no.
Okay. That's okay.
We had to at Cooper, but, you had to write the time that you started working with them and the time that they ended. But there wasn't a certain time frame that we had to be finished.
That doesn't work in outpatient right now, but I am seeing a lot of outpatient clinics write their time in. I don't know that it's required of them, but, it may possibly be, I guess if they got audited
We
and
had
they
to write-
charged for
Yeah.
3 units, they had to show that the time
We
frame
had to
was
write
there.
the time in and out.
Yeah,
Okay,
yeah.
so I guess they're requiring that now
She
for the
said-
different units.
Yeah, one or two,
Yeah.
3 times.
Yeah, I'm glad y'all did some of that.
In there and then charge you.
SNF units are in nursing homes, they're in rehab hospitals, although you don't see them like you used to. Health South used to have a skilled area, and then they had the regular rehab. But now right now Sparks has a skilled unit in it, and, Mercy has a skilled unit in it, and then you have skilled units in almost all your nursing homes. So that's really a separate area normally in a nursing home. You'll have a skilled wing, and that's where your rehab patients go. Okay, so those are separate from your regular Medicare people. Your regular nursing home people.
So those are the ones that are just gonna be there temporarily?
Yes,
Okay.
yeah, and maybe 100 days, but they're there for knee rehab or they've had a stroke, that kind of thing. Really, any kind of
So a
rehab.
lot of them discharge to long-term care though.
Yeah, a lot of them do discharge to long-term care, yeah. On the SNF unit, you are paid 100 days per occurrence or diagnosis. So like if they have a stroke or diagnosis, they have 100 days of skilled care that Medicare will pay for. Remember though, only 20 days are paid 100% by Medicare, and then your other 80 days are just 80%. So if they don't have a co-insurance, and when you're in the nursing home setting, if you know that, you gotta get this person out in 20 days, sometimes that's hard to do because they're not ready to go home, but you have to get them out. Because the family can't afford that extra $150 a month or whatever it is, or a day. I mean, it's pretty expensive. I'd say, it used to be like $80 or $90 a day, and that's when I was still doing nursing homes, and I haven't done them in about 5 years, so I have no idea what it is now. But it's pretty expensive. Because you're not just doing your nursing home care, but you're also doing your therapies that you're paying for. If you, in between there, after that occurrence, after that 100 days, they have to go home for 2 months. 60 days wellness required for a new 100 days. Or, if they have another stroke, they can go back in. If they break their hip, they can go back in. If they have a new diagnosis, they can also go back in. But if they need more rehab and they've used up all their 100 days, they have to go home for 60 days, and then they can pick them back up if they need more therapy.
What kind of sense does that make? Why wouldn't they just run till they're fixed
It
and
just
then let
is,
them go?
I don't know. I don't know what to tell
That's the
you.
stupidest thing I ever heard in my
Yes,
life.
it is. It'll just make you madder.
I'm getting really,
Yeah.
I'm gonna go.
You might not wanna go to
by
skilled
the
care.
end of the
It's
day.
the worst place, I think. MDS, you will hear this term and if you're working. The MDS is well, you do that at work, don't you?
We did do this,
Y'all did the MDS stuff in the rugs?
yeah.
Okay. MDS is a minimum data set, and normally that's a big nursing assessment that everybody who has to do with that skilled patient has to be a part of. And so, what they determine through a computer is they put all this information in, and then they set a RUG level. So a RUG level determines what the facility will be paid for a patient per day. And we have 5 rehab categories, so this is what you have to do daily, or weekly, I should say, in these different categories. So ideally, you want them in ultra high because you get paid more money and you keep them longer, right? So ultra high is 720 minutes, and that's within a week. So 1 discipline 5 times a week is required. You can also do 2 disciplines in those minutes. So that's why you divide out all your minutes and you make sure that you've got them that 51 minutes, and you've got people that go in on Saturday and make up that 30 minutes that they missed on Friday or whatever. So you have all these PRN people. That's why there's so many PRN jobs in skilled nursing, because they have to get this time in. And it can be any 5 days, by the way. Like if someone wanted to not treat their patients on Friday because they had something going, they can go in on Saturday and Sunday. Normally it runs Monday through Sunday, I think is how it is. Very high is 500 minutes, high is 325 minutes, medium is 150 minutes, and then low is 30 minutes in combination with training restorative aids. Do y'all know what restorative aids are? They're people who carry on a maintenance level, and it really has to show not maintenance too. If it's in a nursing home and it's really working, it's great. You've got a restorative aid that goes in and takes on your patients that you have discharged. They get them up and walk them. They do a little exercise with them, but mainly they walk them. So if you got someone where they're walking all the way to the dining hall, then that's a goal to maintain. So that's someone to go in and do the walking, and it's just wonderful to have good restorative aids programs. But almost in every facility I've ever worked in, restorative aids also do transportation. So half the time they're not there to do their job. So then the state comes in and yells at them, and so then you have restorative aids again for a while, and then and then it kind of goes in the cycle again, and they need someone to do transportation or go to the floor that day because they have 6 CNA sick and they have to have them on the floor.
Deanna does have her restorative aid.
And that's all she does. She's not pulled off. That's all.
And they,
Almost all of them do have one.
and usually they'll just write, like him at FMP or whatever, and then give it to him, and he does.
He does what he's supposed to do. Yeah, it's great. It's a wonderful program. It really does help you maintain those people at that level.
Pacola has one too, but they was always getting pulled in the court of
Yeah.
CNA, but
Yeah.
there's hardly ever anybody in restorative.
Yeah, not good. Okay, this is the crazy rugs thing. Again, they do a 5-day assessment, which pays for the first 114 days, the first 1 to 14 days. 14-day assessment, which pays the next day 15 to day 30. 30-day assessment, which pays day 31 to 60. And so you're continuously reassessing these people to see how much money you get a day. Can you see why that's such a pain? I mean, they've hired people just to do these MDSs, these poor nurses, and just to train everybody every time they come on. It's just a very intense, way of doing this that's it just kind of drives you crazy. But as you go into these, I mean, this has been now in place for about maybe 10 years. And the nice thing, I mean, people really have it kind of down. They know what they have to do, and you do your minutes, and you work with speech and OT, and you decide at the beginning of week what you're gonna do and all that stuff. So they have it down, but it's very confusing, in my opinion.
So you walk in this patient's room, you look at your watch, then you do your thing, and whether you're done or not, I'll see you tomorrow.
You can overdo, but you can't charge for an overdue. Like if you only need 20 minutes and you're there for 30, they will probably have you put all that time down, but they have to have a minimum of 720. And they just get paid a set fee, so it doesn't really matter if you spend more
So
time.
kind
You
of
just
like
get,
Obamacare started a long time ago, they just
yeah,
keep working
yeah,
out.
yeah, this was I believe this came from Miss Hillary Clinton. This
Oh,
stuff.
they're
Yeah.
those same people.
Yeah,
so
she was
it makes
helping us
sense.
with the
So,
health plan there for a while.
So it's not about the patient anymore, it's about the insurance company and having to pay a lot of money.
It's
That's
about
what it's getting
paperwork.
down to.
That and paperwork.
Anybody seen Continuum, that show, Continuum? So it's where in the future, where corporations take over the world and just screw everything up.
I was gonna say, I'm not sure that's a good thing. Okay, these are payments again. The first 20 days on skilled nursing, 100% for all therapies and the stay. The next 80 days on skilled nursing is 80%, that's a percent sign, for all therapies and stay. Oh, and this was, I don't know when I put this, but approximate copay for day 21 to 100 if they don't have co-insurance is about $90 a day. So you're gonna get them out of there as soon as possible. Yeah, that's a lot of money for a family. And if you're dealing with an older family that, you know, an older man and they're on a very fixed income or that kind of thing,
So they're gonna pay the 80% after the $90?
yeah, they're gonna pay 80%. No, the $90 is what the family has to pay because that's the co-amount. That's the other 20% of, that Medicare didn't pay, that day 21 to 100. That make sense?
Let me go back to
Is
the
that
barter
only if
system.
they don't have,
That's only if they don't have
Go for a
co-insurance.
couple weeks.
If they have co-insurance, then the co-insurance will pay that. I wanted to look at PTA and SPTA supervision mainly with Medicare Part B. Remember we talked about if you treat a Medicare Part B, you have to have your PT or PTA right there with you co-treating. You can treat, but they have to literally be right involved in that treatment. That's legally what it says. They also have to do the note, not you. That doesn't mean that you don't have to write a note. Some of your CIs will have you do SOAP notes so that you can have that experience. So please do that. You need as much note writing experience as possible. But sometimes, especially Medicare Part Bs, they have to write the note. Okay, and they're not allowed to write the note. Okay. This is looking at skilled nursing care, and this is pretty much just legally in skilled nursing care. Medicare Part A, this is in skilled nursing. It's not looking at the hospital setting. It's not looking at a rehab center yet. I know this is crazy that it's all different. Believe it or not, Medicare is different in an outpatient freestanding facility than it is in a hospital outpatient pay. And it's different in, mainly, it's pretty much against the long time. Medicare, your outpatient physical therapy charges have a limit on how much they'll pay. And so, I don't even know what it is right now. It had gone up for a while. It's like $2,100 or something.
so is this where people were co-treating and not
Oh, I got off.
labeling that they
No,
were?
I'm sorry. Let me go back to this. I got off on a tangent. Okay, let me just go back to this. Okay, individual versus co-treatment. This is just in skilled nursing, okay? It's not in anything else. It's not legally written in anywhere else in Medicare. If a patient is charged an individual charge in a skilled facility, Part A, the therapy must be one-on-one. If a therapist works with 2 patients at once, it is a co-treatment, and each patient is charged a co-treatment charge, and so this would be half. If you worked with 2 people for an hour, you would charge them 30 minutes apiece. Group therapy can have a maximum of 4 patients, but they'll only be charged a fourth of the individual charge. The reason why this is such a change, this happened about 3 years ago, is that a lot of times, I think I've told y'all, ethically, I think co-treatment is fine, and I think you probably give them the quality treatment that you need. What happens is we've abused it and people have done it to where the people haven't gotten good treatment. And but you can't do it anymore. So if you're gonna charge the individual charge, which is the most amount, then you have to just do one at a time, okay?
So what, now, what are you saying, like, you got like 4 people sitting around and you tell them all to do the same thing at the same time?
It might not, or not even the same thing at the same time. If you have them doing different things, it's still considered group therapy, and you can have them all doing different things, but if they're all in the room together with you, the one licensed person, then you can only charge them for, and also the students actually are considered a person that can have someone extra in the area. Like a student in a PTA can be working with 2 patients and charge individual charges, I believe.
So now, when I was at a lead.
This is skilled nursing, this is an
skilled nurse,
outpatient.
Okay, all right.
This
So
is,
it's
you
nursing.
got, it's all different.
Okay, because
so
I was
just-
starting to go, well, wait a minute.
Yeah, no, that's different.
Never mind.
Medicare Part B, treatment for Part B patients is always one-on-one to charge the fee. So with Medicare Part B, you need to be one-on-one, you can't do 2 at one time. Medicaid patients in Oklahoma can only get physical therapy at a hospital-based outpatient clinic. So, and I think they approve 10 therapies a year, 10 therapy sessions a year. So, and most of those hospital outpatient clinics are not taking them. They don't get paid any, by the time they do all the Medicaid paperwork, it doesn't pay them to pay their office help to do it. And so that's why you're seeing even doctors doing half a day of pro bono, maybe, and that's when they do their Medicaid, and then they don't ever charge them. I don't know if you know, but some doctors are actually doing that. It's cheaper for them not to have to hire and deal with 2 more people in their office than it is for them to have someone take care of all that Medicaid paperwork. So they're doing some pro bono people, and they're usually their Medicaid people.
So on the outpatients, they're supposed to do one-on-one regardless?
On Medicare Part B, not outpatients, if they're, workman's comp doesn't care. You can do 6 workman's comp patients at one time.
Okay.
So see, you gotta look at all these different aspects of it.
They have a lot of rules.
And it's just every year it's worse, it's like, but, you know, your workman's comp, that's not the way, and your private insurance, that's not the way. Now, there are some private insurances that do not allow PTAs to work with their patients. And that also happens in Sooner Care in Oklahoma. Only PTs can see little kids in Oklahoma, which is crazy. It's crazy. But that's the way, unless it's changed. I don't think it has. I think it's that way. In Arkansas, PTAs can see their babies. So, but in a clinic where you have a PT, now in Oklahoma, it's got to be a PT.
Just for the kids?
For the kids. Sooner Care is all PT care.
Oh, yeah, they wouldn't let me see any senior care up there.
And I guess adults too, kids and
Yeah.
adults. This goes back to, I think we'll quit here so that y'all have a little time. We'll go back and finish this up next, on Monday. And then we're gonna talk about resumes on Monday.
So if you work in like a clinic or something, do they have people there that will watch over stuff like this for you, or is this something you really have to know?
It's an ethical issue, really. It's a legal issue if someone walks in the door and you're doing something wrong. But you just have to do it, which is the way you're supposed to do it.
Okay, y'all, the Gordon Lightfoot comment.
Got it.
Gordon Lightfoot was in the sixties, was a band, all right?
So he's been.
So to make it all, so y'all know what I was
I
talking
knew
about.
that.
Thank you for bringing me up to
I
speed.
do.
And he's only been talking.
Alright.
And it was a completely.
I don't even remember what song I said, I just remember.
He said we make that all as space. There's stuff on
This one was pretty
Yeah,
long.
the one and then, well, I know he says he only does it.
I know.
They're all right there, the same.
Cause he wasn't actually a guy, right? That was just the name of the band. He's a guy named that?
You may be right, I think that's, I think he's getting that because his kids, we never had a broken
Let me go get my book.
So,
Like if he's news or something like that.
he should be getting better, you know.
He is, but he just has not, that because it's like coming out.
Just to make sure that everything's okay, and that, but that's kind of important. You don't have your rooms and everything, because one that's free moving and that could cause them. So
But
I
you
think,
think the pain would go like that,
Is-
just from him being tense?
yeah, I think he's, you know, tensing up to it and everything's tightening up all up and down his back. It would be probably more, I'd be surprised that it's on this side, but he may tense up on that side just when he's under stress anyway. But yeah, I do.
It's funny when you say
You could
something,
try,
comment,
He
and
said it
half
was
the
like
people
a
get it,
burning.
half the people don't.
And that to me sounded like the one.
And I'm the oldest student
Yeah.
here, so.
Anyway, I just think he needs to.
I know there was a few of us
Just
who
have a
know
look
it.
at it. He did, he's got a general practitioner. I'm one of those people that I go to orthopedic, just because, so I might want to, they'll just have them, look at it. Because generally, unless he's real comfortable with the general practitioner being, so it's been.
I might have that song in my head all day.
I mean, it shouldn't be, you know, it takes 6 weeks to heal, but I still think I'm happy with him. He's not that much better and he feels like it's still really.
Well, this thing has just started, it's getting that pain. That when he was healing, you know, pretty well.
He's taller, because he got more active. Yeah, I think all that's going together, and it's just hurting more because he's moving
He's a
more.
carpenter.
Yeah.
And
Wow.
and he probably does stuff around.
And he probably is right. I'm guessing that he's positive. Still connected, not.
I didn't know if it's come away from the cartilage, I mean, if he holds it there, if it's holding it close, will it heal? I mean,
Well,
how
as long as
vascular it is right there.
It's pretty vascular, but to make sure that that's lined up, you know, I'm
Do you know
assuming
what a
it
hole
still
punch is?
is, but that's what I would be concerned about, if it's out of alignment.
It's not
With
much,
the diaphragm.
it's over here.
Yeah, that's
Tell
what
him
I
not
just,
to lift anything, I mean, he'll just, do that's kind of hard, because he really doesn't, he needs to lay off.
Haven't been riding, you know,
Oh, that would kill him, oh, that'd kill him.
but he gets on the
I
track.
thought weights were supposed to be game day.
Which is awful. really lots of fun, but she's gonna have you facilitate each other from laying down and showing what you can do with your bodies, much less little babies. Has anyone ever taken their baby's head, like a 2-year-old, and just moved the head of it? If she's paying attention to you.
Oh, she's wild.
My last 11 months old, and you know, I think she's trying to do it, she put it in, I'm doing it to me, and our parents were like, what are you doing? I was like,
So you had good, you had that good protection?
You are such a.
well, cause he's playing with the toy, and I was like, watch this. Oh my God, it's like, picked him up and then like, dipped him kinda, and he's like, dropping it in seconds,
We
like,
have to
he's
mail it
like,
in,
no
and then
way.
it has to go to national.
He's like,
How soon did you guys see it?
I wish I could like video it. so
Yeah,
it's
oh,
even-
yeah, yeah.
Or that they could bring him up here, that'd be better.
Oh, that would've been good, cause we
Or
need.
whatever.
We lost it. Maybe Brooke can bring hers, I don't know,
Better stop
she's here
working
on
the corner.
campus, so maybe we get her to do that, but she
Hey,
had a different.
only ring.
Grandmother did.
Grand Hodian.
I wanna say they found out about a year ago, and it was like shreds, really crazy, and like, they had to remove tumors in his brain and some in different part, you know. They removed his nose, they've done the external, they've done it, you know, like in the military, and he had really good insurance and stuff, but
I read on
it's
foot.
now that they're like, not gonna do it anymore. Yeah, and so they're like looking at hospice stuff.
That's hard.
You know,
Bet you I was running a 5-minute mile
the
then.
only